I'm pleased to be joined today on Health Beat by Dr. Angela McLaughlin with Faith Regional Physician Services Family Medicine in Wayne. And many people are having difficulty identifying concussions. So please explain what to look for and what the treatment options are.
One of the things you want to look for is any memory issues after some sort of incident of trauma happens. So even if they're not quite thinking correctly, don't know the date, don't know what just happened to them, those could be indications that they need to seek help for identifying concussions. A lot of times for sports, they will have a concussion questionnaire that they ask the athletes before, so that way they have a nice baseline, and then they'll ask it, if there is a suspected concussion. And important things to, I guess, keep in mind are that the #1 treatment option is rest your brain. And that is rest from screens, rest from critical thinking. So a lot of parents don't want to hear, hey, you know what, we don't want your kid to be on their phone, we don't want your kid to even go to school sometimes, depending upon how the severity of the concussion. But rest is going to be really important. But another important symptom to look for is a headache. Headaches are fairly common, but if your son or daughter starts complaining of a headache and they hadn't before, and you kind of think back, oh my gosh, they had this kind of rough either collision on the field or they had a fall, that's kind of an indication they may need to come in for further evaluation.
So there are some myths out there regarding concussions. Can you address some of those for us?
One of the big myths is that someone with a concussion will have a loss of consciousness, meaning they are knocked out. That only happens in about 10% of cases. A lot of times when an athlete is in a collision, they may not even notice that they have a concussion. It's hard for someone with a concussion to identify that they have it. Another myth is that you should let the person, or not let the person fall asleep once they have had the concussion, and that's actually the brain's way of resetting, so you want them to have plenty of sleep. They may sleep way more than they're used to. And then the final myth that I really wanted to dispel is that they need imaging. They really don't need imaging most of the time. There are certain red flags that your doctor will look for, but a lot of times all the imaging will be normal in a concussion.
I see. Well, thank you very much. And that's Health Beat, brought to you by Faith Regional Physician Services.